Over the last few decades, there has been mounting research showing the ways in which singing is beneficial for those living with a range of conditions, including respiratory conditions, dementia, Parkinson's, and mental health concerns. Aligned with this research is the establishment of several Singing for Health groups run by expert practitioners who use a variety of techniques to support those living with such conditions.
Indeed, in Scotland alone, there are over 90 different groups across the country, spread across the Highlands, Islands, Central Belt and borders, and new groups are regularly established in various localities.
It is not just the act of singing itself that is useful. For example, someone living with a respiratory condition might find it useful to attend a standard community choir, but they also might struggle in that environment because they are not able to be fully supported in that setting. Singing for Health groups are much more bespoke, with the singing leader trained to understand how to best support those in their group who are living with such a health condition. This is why there are groups that specialise in supporting those with specific conditions.
Scotland's Singing for Health network unites practitioners, researchers and health professionals working in these health-related fields across Scotland.
In this series of 4 short videos, we'd like to introduce you to a few of our expert practitioners who work with those living with respiratory conditions, dementia, Parkinson's and mental health concerns, and allow them to showcase the techniques they use to best support these individuals. We will also introduce you to some of the research that demonstrates why singing is useful in supporting those living with specific health conditions. Finally, we will signpost you to where you can find out more about the research and where you can find a group in your area.
In this video, we will focus on lung health. Singing for Lung Health is a health intervention for individuals living with chronic respiratory illnesses which cause breathlessness, such as chronic obstructive pulmonary disease, known as COPD, asthma or bronchiectasis. Over the past 2 decades, singing has been developed as a form of pulmonary rehabilitation that helps individuals learn to manage their breathlessness. The first respiratory singing practice was established in 2007 as a pilot project in the Royal Brompton Hospital. Since then, singing as a respiratory health tool has grown in practice with over 100 groups in the UK. In that time, Singing for Lung Health has also grown as a topic of clinical research and randomised control trials, giving us a huge body of evidence into the physical effectiveness, as well as the social and mental health impacts of singing. Singing acts as a physical exercise that helps to build stamina, as well as creating a supportive space. A publication from 2021, authored by Adam Lewis and colleagues, has illustrated in depth the physiological aspects of singing exercises, song phrases, breathing exercises, posture, physical movement, exercise and relaxation, which are used in Singing for Lung Health sessions, and their effectiveness at targeting COPD symptoms. Another research publication from 2021, authored by Keir Phillip and colleagues, illustrated that singing has the same physiological demands as brisk walking on a treadmill. And as such, Singing for Lung Health sessions are important for building physical stamina in people with lung conditions. Further studies have pointed to singing being as effective as pulmonary rehabilitation for improving physical health outcomes through these physiological demands, coupled with breath work that focuses on diaphragmatic breathing and extending the out-breath. Research has reported reduced GP visits as well as reduced hospitalisations for people who attend Singing for Lung Health groups. Teaching people breathing techniques through singing provides them with the tools to self-manage their condition, enabling them to control their breath in moments of breathlessness. This gives people confidence to go about their day-to-day lives in the knowledge that they have agency over their breath and body. Singing groups are also hugely supportive spaces that build community for people who may otherwise be isolated by their condition. The Scottish Government has named singing clubs as an important intervention for providing peer support for individuals living with chronic respiratory illnesses in their Respiratory Care Action Plan for the years 2021 to 2026. In these safe, supervised spaces, breathlessness is reshaped from something that is terrifying to something manageable. People will often become breathless in sessions, and that's okay, because in the supportive atmosphere where people are enjoying singing together, there is no stigma, and singing reframes breath as something positive, creative, collaborative, and fun. In 2013, 3 general practice nurses, Pauline Waugh, Anne Ritchie, and Sarah Marshall, who all had a love for singing, embarked on a research project to look at the impacts of singing in a group on the quality of life for those living with chronic obstructive pulmonary disease, or COPD. Since then, the project has grown into a much larger venture, having become the charity the Cheyne Gang, who established singing for lung health groups across Scotland. Anne Ritchie, who is coordinator for the Cheyne Gang, is here to tell us more about the formation of the Cheyne Gang and what they do to help those living with respiratory illness.
So in 2013, my colleagues Pauline and Sarah and I were discussing the fact that there was a real dearth of help for people with chronic obstructive pulmonary disease in terms of anything that wasn't pharmacological. And so we knew about pulmonary rehabilitation, but at that point in Edinburgh where we were working, it wasn't really widely available. And so we all like to sing, and we decided to have a wee look to see if singing would help. And we looked at the Sydney DeHaan Centre at Canterbury University, and they had done some work on singing for lung health, along with all the other work that they do for singing for health. So we asked the Queen's Nursing Institute for Scotland to give us some funding, which they did, and we set about setting up a research project, a 6-month research project. So we had 8 patients. They were all patients of one practice. There was 2 practices involved, but all patients of one practice. And we asked them questions at the beginning. We used a form called an AQ20, which is 20 yes-no questions. The more yes answers, the worse your quality of life is. So we asked them those questions at the beginning. We sang with them for 2 hours every 2 weeks for 6 months, and we asked them the same questions at the end. We also did some qualitative interviews to just see what sort of impact the singing had had on them personally and whether they'd enjoyed it or not. And also we looked at their medical records because we were able to do that. So what we discovered was that their quality of life improved significantly, and also there was a reduced number of antibiotics prescribed. There were no hospital admissions versus the same period in the year before. And so we decided at that point, when we launched our results, and there were a couple of respiratory physicians in the audience, and they said to us, if you can extrapolate these results, then that would be fantastic. So that's what we've been trying to do ever since. So from 8 patients, they became 8 members, and we now have about 180 members and 4 groups in Edinburgh, 1 in the Borders and 1 in Glasgow.
Panna Muqit, GP and Honorary Senior Lecturer at the University of St Andrews, has a special interest in highlighting the importance of singing for health, particularly to the students with whom she works. She is here to tell us more about why she is interested in singing for health and why it is beneficial for her students to know about the work of singing for health practitioners.
So I see patients with a variety of lung conditions, most commonly I would say COPD and asthma. Acutely I'd see people that present with chest infections, or come in rather with chest infections. A whole spectrum of other lung conditions, from pulmonary fibrosis to chronic lung conditions such as bronchiectasis, lung cancer at various stages. So a wide variety of lung conditions. Yes, I think singing can help in a variety of ways, right from helping with the muscles of breathing and strengthening the muscles of breathing, through to being able to take a very deep breath, which otherwise I think people with chronic lung conditions or even acute lung conditions suffer with taking quite shallow breaths. So it helps with that. It also helps with, I think most importantly, the social aspect, I think, as well. You know, a lot of people with chronic lung conditions are lonely, and they really benefit from the group activity of singing, meeting with others, and I think that also then helps the relaxation, which again is so important for breathing. For most people with a lung condition, whether it's chronic or acute, sometimes that sensation of breathlessness and feeling out of control can be quite anxiety inducing, and actually, you know, by singing and working on your breathing, that really helps reduce that anxiety, I think, by just taking everything a little bit slower, a bit deeper. And I think by speaking about breathlessness as well, that also reduces the anxiety, because I think, understandably, feeling breathless is a worrying symptom. So I think that's quite a tangible benefit that a lot of patients get when they attend singing groups or practice singing regularly. I like exposing my students to alternative therapies, but also a holistic way of treating a patient. I think that's really important. I'm a doctor, so classically, you know, we give medications to try and help where we can. But I always feel that actually, if we tackle the patient holistically, look at their lifestyle, look at other ways that perhaps they can socialise or integrate with others, that really helps well-being and boosts recovery.
In addition to co-running Scotland's Singing for Health network, Sophie is also a Singing for Lung Health leader who runs her own group in Dediston. She is here to explain the techniques she uses when working with her group.
So I'm going to do some examples of exercises that I would do in a session with my Singing for Breathing group that I run here in Glasgow. First of all, everything that I do with a group is always an invitation. Nobody has to do anything that they don't want to. And people might run their groups in their own styles, but always with these same elements as part of them. We'll always start the session doing some physical movement and relaxation to help people's bodies ease into that singing space. So we'd probably do some shoulder rolls, because we're really wanting to help people relax these muscles that they've been using for their breathing to really bring that down. So doing some shoulder rolls first of all, and some gentle movements, wiggling fingers, involving some arms. Just getting the body relaxed, ready for singing. After doing that for 10 minutes or so, we'll move into doing some breathing exercises. Working with people with respiratory illness, what we're really focusing on is bringing the breath all the way down here, rather than short, shallow breaths up here with lots of tension. So once we've removed all that tension from our shoulders and neck muscles, we're really focusing on this area here. So it's asking people to locate their belly button and this area just down below, and just checking in with these muscles. We use these muscles for our breathing, and something as singers that we really learn is to support our singing and our breath with these muscles. It's sometimes called diaphragmatic breathing. So we're checking in with these muscles here, and we'll have potentially a sigh out. We might then extend that a bit with a and release. So that the in-breath is really coming off the back of the out-breath. So getting all of that breath out and relaxing these muscles to bring the breath in. And that gives people the tools in their day-to-day life, if they become breathless, to learn to do this automatic breathing down here rather than shallow breaths up here. So really help people control their breath. Also, what we do working with people with respiratory illness is extend the out-breath. This is because people with, for example, COPD, the alveoli in the lungs have lost that elasticity. So it's very hard to get the breath out of the lungs. So doing singing exercises that have really long phrases help to really get the breath all the way out of the lungs so that people can achieve a deeper breath. I'm going to do an example of a cognitive singing exercise, so a real brain gym workout that gives an example of how a long phrase will be introduced into a song. So it's going to start with 2 short phrases, then there'll be a long phrase, and it's going to go like this. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3. 4, 5, 1, 2, 3. 4, 5, 1, 2, 3. 4, 5, 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, 1, and it keeps going. That was an example of 2 short phrases, 1, 2, 3, 4, 5, release, 1, 2, 3, 4, 5, release, 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, 1, 2, 3. A really nice long phrase, engaging these muscles here, getting that breath all the way out. But because it's a brain gym exercise, we're not focused on that breath, we're not worrying about that breath, we're thinking about the sequence of numbers. So an exercise like that would be really appropriate in a Singing for Lung Health group. This is a very brief overview of the research and work that is currently taking place in Scotland. Scotland's Singing for Health Network website provides much more information on existing research, as well as a map to the various groups operating up and down the country, training courses available for practitioners, and links to our podcast series where we interview organisations, researchers and practitioners who discuss the practice and research relating to singing for health in more depth. Our work is ongoing and we have so much more to share, so please get in touch with us if you would like to know more. Our website address is available on the screen.